All right, Saagar, what are you looking at?
Well, I've been covering a lot of health and wellness stuff lately here at Breaking Points, mostly because of my own personal interest, but also because of how much health and discussion around it has become terribly politicized since the outbreak of COVID. We've seen the perversion of science, especially with respect to pharmaceutical drugs and medical interventions, become infused with social ideology that can have really destructive results if they become normalized to the general public. Perhaps the most destructive is a perpetual message recently that it's okay and not unhealthy to be obese, or that if you are, it's not your fault at all. Now, it's just cringe magazines, it's not just them that are pumping this message. It's some of the most prestigious platforms in the United States, like 60 Minutes. I somehow missed this January 1st segment that they ran until it was featured and then debunked by my friend Dr. Lane Norton. Listen with a straight face as this so-called obesity expert claims.
I've always heard that it's the fast food, that it's the Diet Cokes, that kind of thing, that is the instigator. Is that true?
So I think we have to look at the different causes of obesity as a big pie, and that's one factor. But notice how I'm using this part of the pie, right? But the number one cause of obesity is genetics. That means if you are born to parents that have obesity, you have a 50 to 85% likelihood of having the disease yourself, even with optimal diet, exercise, sleep management, stress management. So when people see families that have obesity, the assumption is, what are they feeding those kids?
As Lane points out on his Instagram page, that is just literally not true at all. The reason the kids of obese people are usually obese too is because their food environment and lifestyle mimics their obese parents. Genetics, of course, will play some role. But let's say you transport that family unit to sub-Saharan Africa. You really think they're still gonna be obese? Obviously not, because the environment, both at a macro and micro level, is going to have a major outsized impact. Furthermore, this supposed expert actually denigrated fellow physicians for asking follow-up questions to obese patients when they claim they are making lifestyle changes. Listen to what she's preaching.
79 to 90% of physicians in the United States have significant bias towards individuals that are heavier. Now, doctors listening to me may say, oh, it's not me. Hold your horses, because has that patient come to you and told you, look, doc, I'm eating well. Look, doc, I'm exercising. And the doc says to them, are you sure? I don't believe that that's really what you're doing.
Wait, are you saying that doctors don't understand obesity? Doctors?
Doctors do not understand obesity.
Listen carefully to what she just said. If you have a doctor and you have an obese patient not losing weight who's coming to you, and they tell you that they're making major lifestyle changes and nothing is working for them, you have, quote, a significant bias against that patient for asking a basic follow-up question rooted in the fact that you know that if what they were saying was actually true, they would be losing weight at least somewhat. This is a cancer of so-called bias training and of therapy culture, worming its way into nutrition guidelines. It's exactly how the American Academy of Pediatrics got itself into a place last week where it says doctors should use drugs and surgery earlier in kids who have obesity without the appropriate emphasis on lifestyle intervention. But the story does not end there, because the doctor I just showed you is Dr. Fatima Stanford. She's a so-called obesity medicine physician scientist at Massachusetts General Hospital. And wouldn't you know, also the, quote, equity director. And in my research for this piece, take a look at what I just discovered. 3 days ago, Dr. Stanford thanked the Biden administration's USDA and Health and Human Services Agency for appointing her to the 2025 Dietary Guidelines Advisory Committee. Dr. Stanford will be one of just 25 public health so-called experts that contribute to the expected 2025 report, which will be the official U.S. government recommendation on nutrition from 2025 to 2030. These nutrition guidelines have a big impact on society. Food stamps, school lunches, to how people in the media just talk about it. It's very dangerous to have somebody like this shaping government nutrition policy, someone who claims exercise, nutrition, and lifestyle are secondary to genetic factors when we know that is not the case, and someone who is already spreading this poisonous message at one of the most influential hospitals in the world and Harvard University. And while I believe Dr. Stanford is just your typical woke intellectual, we also have to question the financial incentives. Dr. Stanford's media tour has included past praise for the, quote, intuitive eating movement, which is a rise up against diet culture, guidance to people that they should eat whatever their body tells them to, possibly the dumbest advice on earth considering how processed food is specifically designed to be as palatable as possible. But putting the idiocy of intuitive eating aside, check out this caveat that even the New York Times had to feature, quote, Dr. Stanford has served as an advisor for a number of pharmaceutical companies. Oh, really? It actually only took a few searches to see that Stanford is even featured on the website for the leading manufacturer of semaglutide. You do a few more searches for open source data regarding Dr. Stanford and who is paying her, and the results are astonishing, or maybe not all that surprising. In 2021 alone, she was paid over $35,000 by Big Pharma. $15,000 was paid by the manufacturer of the Wegovy weight loss drug, which she has been openly campaigning for in the media. Is it a coincidence that the vast majority of her consulting income, which is public record, came the very same year that the drug was approved by the FDA? Keep in mind, 2022 data is not even public when the drug actually reached escape velocity in our culture. She did an interview with the New York Times just a few days ago. Dr. Stanford said she had no concerns whatsoever about patients using semaglutide on a long-term basis to keep weight off, and actually advocated for a new bill to pass Congress called the Treatment to Reduce Obesity Act, which would authorize Medicare to cover that drug. That would be a $1 billion windfall for that drug company, which is paying her. And look, to be clear, I think semaglutide probably is an amazing drug for people who are morbidly obese. But what's really scared me is Dr. Stanford analogizing weight loss drugs to SSRIs, how stigma on them needs to go down. Now, I don't believe in stigma for people who have depression, but didn't we also just learn this year that SSRIs do not work in the way that they claimed to work for a decade? The chemical imbalance thesis is bunk, even though SSRIs do seem to work in some capacity, just not the way that the drug company claimed. How many alternative treatments were lost because of SSRIs not given a chance? How many people were put on a pill with a dubious action mechanism when they could have tried something else? We don't need to do this again. There is no such thing as a silver bullet, especially when somebody is trying to sell it to you. I mean, I think it's a crazy story. The initial reason why I looked into—
Hey guys, ready or not, 2024 is fully upon us now, and Saagar and I have been brainstorming ways that we can really up our game for this critical election.
Yeah, we rely on our premium subs to expand our coverage, to add staff, to upgrade the studio. We just want to give you the best independent coverage of this election, which is possible. So if you can help us out, become a premium subscriber today, breakingpoints.com, or the link is down here in the description video. It really means the world to us, and if you like what we're all about, this is the best possible way to keep us 100% independent, working only for you.